Vertigo is almost always effectively evaluated in the office. This is evaluated by history and a good physical examination. Diagnostic testing is very rarely indicated. Now, when it is, it's important, but most of the time it's not. Vertigo is virtually always evaluated effectively by history. And depending then on your impression of the underlying cause of vertigo, you may need more definitive diagnostic evaluation to support your impression. But first up, the history is important. So once you deduce that there is spinning going on, the next thing you're going to do is rule out systemic or metabolic causes. Some of this stuff should be starting to look familiar to you because there are some similarities here with ataxia and near syncope. Many of the same medications that can cause ataxia can also cause vertigo. We also have a psychogenic vertigo wherein nothing else makes sense, right? Like you go through a good history, a good physical examination, the patient is experiencing vertigo, but nothing they're telling you fits in to any of the common causes. Also, vertigo may be consistent with infection. Again, central nervous system infection. And another infection that's fairly common is true bacterial sinusitis, like especially sphenoid sinusitis. Remember you have four sinuses and three of them are fairly superficial, but that sphenoid sinus, those are like deeper in the brain. And when patients have an infection there, which we hope they never get, but if they do, the symptoms aren't usually the localized typical sinus symptoms. It's really more systemic and very often starts with a sense of vertigo. And the hypoxia is another one. Any condition that can make the patient chronically hypoxemic can cause this sense of spinning, although usually if you're hypoxic enough to be vertigus, you're probably pretty hypoxic and it's not like a big mystery. It's more about recognizing that all the other bad things that happen when you're hypoxic, vertigo may be one of them.